having received over 23 billion. That has gone to the communities there. Where is the impact? We may talk of seeing impact after some time, but if we go by what Sunday say, you get money, you start. It's not only what Sunday say. If you go to trading centers, when people get this money, all the beers will be gone, all mattresses will be bought. Is that sustainable enough, really? Is that what we are going to do with this money? When shall we convert this money to be able to put more classrooms, to be able to put more toilets? In schools, WHO officer was saying, to decongest. We discussed this at national level when we were in the Hotel Africana. That was the proposal. We told the government, allow us put temporary structures. How could that come? We will engage our parents to come in and put temporary structures to be able to decongest this. The Prime Minister said the government is possible. You only report the gaps. The government is going to fill them. How long shall we take to fill these gaps? How long? That even if you charge 500 shillings on a parent, you must be arrested. And you read on media, in some districts, head teachers who wanted to defy that, who wanted to pick some small development money from parents to be able to put temporary structures, they were arrested. They were arrested. Now what are we going to do? Must we continue to lament like this? Even if we treat these people and still we have the conditions prevailing, what are we going to do? We shall be mark timing. We treat these ones, more will come. We treat this, more will come. If you look at the figures here. So, my point here is at national level, we should really be able to sit in the ministerial meeting, in the partner level, we should be able to sit, advise the government on the rightful prioritization of interventions. Rightful prioritization of interventions. If this money, if this 23 billion was given to government, where would we have gone? Would we be talking of this condition here in school? That money will only address household level issues where people are expected to have good housing, have good feeding. What can 1 million do? Can 1 million be able to make people afford good living in the shortest possible time? Can it change their eating behavior in the shortest period of time? The issue here is priority setting. If we continue to move like this, we will continue to see this kind of conditions in our country. Let truth be told. Let's reorganize our thinking at national level. We learn how to do better prioritization. Otherwise, if that is not done at local government level, this decongestion will not come. This issue of looking at the decongestion will not come. Maybe at that level, you advise the government. Let's go back to take responsibilities. Let's allow parents to take responsibilities. Why are other regions doing well, very, very well? Why are private schools doing very, very well? Those conditions are conducive. They are moving on. As local government, we have put our position clear through Oluga, but at the moment, government is not listening. Priority setting, if I can repeat. Thank you for listening. But I also beg to leave early. I have some touching issues somewhere. Maybe if I sneak out when it comes to closing remarks, you will help me put in my shoes and say the closing remarks. Okay? Yeah. Thank you for listening.
Thank you very much, members. You can see that I was right to have kept quiet when the governor was making the submission. I only pray that our friends of the media here don't speak the other side of your communication. Let them know that you have said this as chairman of NRM flag bearer. and chairman of the district. Because in one meeting, the DHO, Dr. Zubo, with his said that the central government has decentralized the problems and has re-centralized resources.
And there they say your position. When you are eating, they say you're the top. They say your position.
Okay. The chairman had just given the situation of where we are, where we found ourselves very difficult moving forward. But that will not stop us from forging way forward for us. Even if it means going back to the central government and say, we have a plan of doing this, we are crippled, kindly come to our aid. They are here. WHO is here, MYH is here, the region is here. More submissions. Chairman. Alikwa.
Okay, thank you very much. My name is Maracha.
Be mindful of time.
Yeah, thank you very much for the presentation here. The thing is, there is tuberculosis in all the communities in Maracha, even including my village. When the DHO was presenting, I think he presented the situation of the TB in Maracha district. And I want to accept your presentation. And you are right. There's a tuberculosis in Maracha. I think when the TB cast and the campaign was, when you get the report here, you will see you presented I have seen 14 health facilities. And the Ariba sub-county only at the Yuba Bear Health Center 3. That is now the chair of Ariba sub-county. The Yuba Bear, the only health facility. I don't know my status of TB. In Yuba Bear, in Ariba sub-county. Because I have seen the 14 health facilities that I think the campaign was done. What happened in Arikwa, especially Yuba Health Center? I've seen also. I've also seen you have gone to Ofuda Primary School when you are presenting. I think you have 26 people who are diagnosed and positive with tuberculosis in Ofuda Primary. Then Ofuda Primary is one of the schools in Arikwa sub-county. I've seen you have written use of the local government, but that Ofuda Primary School is in Arikwa sub-county. But I want to follow you in advance, by the way. So that I take my initiative as chair to go to Pakayopolis, where the primary school is, and inform the communities there. Thank you very much.
Thank you very much. That's a simple geography that was missed by another person. But unfortunately, the document went through many hands that also did not see. Thank you for being very critical. So on the results for Furen, and you will then move on. The issue of why 14 facilities, Edward, you respond to in line of the detail. You call that DTUs. Okay, fine. Here, maybe let me take a line. You, and say hello.
Thank you very much. I'm most grateful, Chair Paraga. And as they were presenting my health unity 3 at Koro, there was a total 0 tested, and everything went to 0. And I am at the hot post when you check the Malaba, there is a free entry and a free exit of people moving across. And you know the medication in the other side of Congo. I also have the army. I have around 8 primary schools. And yet one day I was also moving to the health unit to monitor. I happened to get information that the person I carried was having TB. So I was already worried here. It means I should also be tested. I might be having TB. So, as the managing director of health services, why is it that it was not happening in Chikoro when other areas were reporting cases of TB? So this is my cry. I wish if there was maybe lack of the testing tubes, you are vain. I'm ready to go and test myself. Thank you.
Thank you very much. Even if it doesn't have to be in Ajikoro, you will still be tested, and we shall all be tested. Ajikoro Health Center missed the information on TB from the social media platform that was used. Basically that. It is not anything to do with the staff rejecting whatever, no. When I saw 00, by the way, I supervised that call myself, directly myself. I had to make contact and say, oh, I have seen zeros in your custody, what happened? So they didn't do it that time, but they're doing it right now. Okay? Right now, samples are being collected, the charge is here good enough, samples are being collected, and you can be sure that TB is, that didn't mark end, we are continuing. So Ajikoro has now started intensifying theirs, samples are coming in, we will be assessing, and a report will be given at a later time. But let Edward and your team know that he once carried. Okay? Thank you very much. Yes?
Thank you, Chair. Thank you. Thank you, Chair. Protocol observed. Health Secretary and Officers and Scientists. The Outbreak officers. Chair will lead guidance on formation of sub-county task force committee. That is about the composition. Who prefers to be a member there? Chair, we have there's a TB resistant TB drug resistant TB patient. There's a mechanic at the Outbreak Training Center that is at the Uganda-Congo border. That boy is very, very stubborn. He defaulted. He did not complete his treatment. When we wanted him, he escapes to Congo. When he comes back, I was told or guided that we will not use force arresting him. So I don't know how much TB he has spread now. But lastly, with the help of the TB focal point person, we managed to pick him. He was taken to a rural hospital, but from there he also escaped. So I will need your guidance on that, because he's at large. He's still repairing motorcycles at the Outbreak Center. Using force and cancelling him, which one is better? For me, I prefer force. So I need your guidance on that. Chair, we are all responsible for this. The hotspot points one of which is Malwa. Sincerely, if we don't lead by example, we shall fail. Because I see most of us, even the health workers, they do enjoy second the Malwa. So we should focus. Right now we should focus at our homes. What about the sanitary facilities? The homes, the houses we are living in, how are they built? So it is our responsibility to make sure we lead by example so that the people will lead copy from us. Thank you, Chair.
Thank you very much. Raised 3 issues. The last one, just for us to note, DHO, at a later time, you will give guidance on the sub-county task force. Then Zono, you will respond to guidance on how to handle those difficult clients.
Thank you, Governor DC, District Chair, all for reserve interest of time, Godfrey, Education Department, my immediate supervisors here, represent the DEO, in line with what is happening in schools, we mentioned land development. One of the key factors that will lead to rapid spread of this disease is congestion. According to our personal inspection reports, all our schools do not meet the health minimum requirements for us to achieve have better learning achievements. And when you see the enrollment in class, by the size of the class, there's a unproportional class size number. Madam Chair, this affects learning and it can cause rapid spread of this TB in our schools. This is immediate response to the intervention. My humble submission to you is, during those days when there was insurgency in Congo, Red Cross responded by supplying tents to accommodate the increasing number of refugees that was flooded in Congo. My humble submission will be, tomorrow as His Excellency will be in the region, as this is one of the key pandemics that have to follow our region, we will request you to table that the temporal tents should be supplied or donated in these centers, schools that are highly affected with this infectious disease. 2 is in response to sharing international boundaries and diplomatic meetings. Uganda is one of the peacekeeping missions where there's insurgents in the middle of the Uganda also intervenes by deploying Navy force and the shower. We used to have a traditional killer stood in Ositibuku, a place called Kidia. I thank the local government of Rufe through initiating local diplomatic meetings. That man was evicted there. But as of now, this man is settled around Atoro there. There are very many small round house buildings there as well as for accommodating patients. And it is around 200 meters from Uganda border. I think that is the point where most of our people go there for treatment, for traditional killers treatment, and they can get this infection. Because now the communicable diseases don't have boundaries. Can you intervene with the neighboring administration of Congo to ensure that such person is also pushed away. Now if he goes to the university, that side will not be our problem. Because of this has intervened, and then the next thing he has pushed it there. So I will request the force from that side to push him away so that he will be safe. Thank you.
Mr. Inspector, if that man goes to Arua City, he still remains our problem. He still remains our problem. So, pushing from Maracha to another locality within West Nile has not solved any problem. But on that submission, I want to say this. Madam Chair, as Chair of the task force, kindly enforce what we had agreed on. That local government submit to you the list of hotspots, including those shrines. A decision will be taken at task force level at the district on what approach can be applied to those people in consultation with the high authorities like ministries and so on and so on. These guys are rampant and everywhere. Am I forgetting my people?
Yeah.
Here. And then say hi.
Yeah. My name is Gabriel here. Here you sir. I want to begin from where my colleague has ended. We have very many shrines. Even as I'm talking now, I have one in my sub-county. When we said, let's do something, the district had let us down. Madam Waradisi, I hope you will unite with us, such that these shrines are going to disappear in Maracha permanently. When there was outbreak of measles patients were heading for prayers near Media Primary School. Again, this time, there was a TB patient who has been receiving treatment in a regional referral hospital. And one of the Saturdays, I saw that person going for prayers at the same shrine. Where are we? Are we really safe? There is a word which I still remember when we were for the burial of our colleagues, their wife, in Awiziru. A word from one of the top leaders in the district, which discouraged us completely. Good enough, the person is now away. Can we begin it afresh? I always tell the truth. I call the spade spade. Truly our pupils and the infant teachers in the primary schools, they are at high risk. I risked Media Primary. The teacher was standing, teaching, turning to the blackboard, was just this. What cannot happen? As my chair alluded, our problem is we don't prioritize serious issues. And when we say, if this money for PDM was given as the government used to give DDEG, Maracha will now be better. This money has very little impact. And very few people who really think of their future can only utilize the money effectively. This time, we go to the facilities at a dire state. Even up to now, we have failed to fence our facility there, near the health center. We have failed to renovate the staff houses.
beds are not enough. The direction is really somehow lost. We have all forgotten about of the SOPs. Turn to your friend, look at your friend. And very many masks they are brought there. I don't know whether they are reserved for sale or what. They are here without their masks. And we are the very leaders who are moving into the TB community. Markets. We also do acquire this in the markets. So, where we are concerning TB, we are at a greater risk. And our borders are porous. Anybody willing to come to Uganda is just welcome. One day I was going to Congo. They asked me, you are coming from Uganda, can you give me your COVID test card? I left mine at home. They told me you are not crossing Tulu. And for sure I did not cross, and I did not negotiate with them. I had to come back. So some of our problems are beyond our control. But this one of the shrines, please and please, can you watch out? Thank you.
Thank you, Chair. I come from this sub-county. Chairman, you should have told them that your budget for development for the whole year for that sub-county is 7 million. Has it gone higher than that? The last time I was there, it was 7 million. Budget for development in a whole year, 7 million.
That is almost my monthly salary.
So, in other words, the DHO is saying he's richer than your sub-county. But I request, before I go to another person, I request that you now secretly speak to the chair. Speak to the chair of the DTF. Even me, I am interested in that word, which is still annoying you. In that word. The person has gone, but the word has remained here. It can keep damaging us. So tell us what that one is, so that we can work. We can work to change that. I have one fear. I have one fear. That the issues I really want to capture are not coming out. I am not hearing commitments. What are we committed to do in this TV situation? As local governments, as departments, as what? What are we committed to do? And you see, these are things we want to put in WHO called response plan. We want to put them there. They form part of our interventions. Okay.
Thank you so much. I want to thank the technical team for the technical analysis of all the matters. From the start of the meeting and up to where we are moving now. You have raised it rightly that as we talk, we should be able to attach recommendations. One of my recommendations is that this is what is called a disaster. Sometimes we think disaster is about might be flood, heavy storm, or what. We do not get to know that this is a disaster. So when there is a disaster, we are supposed to prepare a disaster response plan. As we do the technical activity here, the disaster response plan also must be there. And disaster is directly under office of the Prime Minister. And on this note, I request that we prepare a technical document and we give it to that ministry. Sometimes we think the OPM only gives food or what. But the other day we were in consultation. 2, we have talked about our enrollments in schools. I know I have gone to all these schools. When you enter P1 up to P4, virtually there is no space. And our children also sit on the floor. I appreciate it, I know that. But also a district, we should now be able to think on a strategic angle as we talk of daily activities. As we talk of matters which are on daily basis, we should look at strategies which will be able to help us in the next 5, 10 years. I think our schools are becoming small also. The schools are becoming small. The population is on rise. And the number of schools remain the same. We have 63 government schools. 63. Even for me, I can say 62. I can say 62. Because Kakwa Corps has no characteristics. So, on that note, as people of Maracha, we have also never said as community, this is land for our primary school. All our primary schools are attached to churches. But as people here, we have never said to ourselves that now this is the land for creation of a primary school. It is time for us to think outside the box. The LC3 chairpersons are here, and our people are here. I appreciate that we forwarded schools for coding, and the process is still on. But also for the long-term solution to some of these things, we should only not think within our range. We should think in a long-term approach. So that is one of the things. The porous border. 2 weeks ago, we received a directive from Office of the President, from State House, and a team was sent on the ground, and we were at Assembly. Chairman Rambo is here to witness. We were together with him, plus the team. So it is, yeah, the cry has been, for the border issue has been for a long time. But also our effective communication to issues that are raised causes all these approaches to happen. So we think if we continue communicating, we will always have answers to the matters that concerns us. By the way, continuous communication was able to cost 1 billion for rehabilitation of classrooms in the primary schools. And that is a positive move. But we need now to say we need more schools to decongest the existing schools. That can be also another approach. And we need to do mapping of where is it that our population is biggest and where is it that the population is small. The other day we were in a old sense, like in a Gay Town Council. Very beautiful structure for secondary school, but the population is low. The population is low. Now, how do we justify that we are doing mobilization? It is all of us. So we need to do mapping of our schools with the highest population and of our schools where we can create more, we can think of having more schools. These are some of the strategic. And the issue of shrines. Doctor, the last time we sat for our meeting, MPDCR meeting, that was an issue. And I have already tasked my team to follow that up. The CLO is preparing that. But also, from the that you must give me list. This time I'm going to put it in writing. So that tomorrow you do not again say, I don't know. We told you to give us a written report, but none. And your security chairpersons in your areas of jurisdiction. So as you blame this side, we also want to tell you that you have tasks to accomplish. So let's all do our work. As my letter reaches you, give me the list in writing with names, location, telephone number, and all those details by gender, whether these people are women or men, whether they are Ugandans or non-Ugandans. All these characteristics must appear in that. Now on action points again, I also want to know, since we have just been in TB cast, when are we moving down again? Because now the diversion has been from actually Saborito now to Maracha. How many of the equipment, the drugs, the what? We want it by numbers here. What are those tangible things which must make our operations on the ground active? And what is the action plan like? When are we beginning field again? When are we reaching out to the school? And how do we do it? How much is the money? If there is no money, how shall we move? These are now the things I thought we should be able to discuss and have action points on the ground. So that this manpower will know that on Wednesday we are setting off to begin off. I think that is where we are supposed to be. Yeah, thank you so much.
Thank you, thank you, thank you. DU, then I'll come back here to say that.
My brother Sander was almost concluding, you don't want to pick my hand. But you have picked my hand now.
Don't worry yourself. You are one of the
I want to
generals.
give a commitment on one. I agree we must do timely screening for TB in our schools. We need to now like the work plan together. Two, health and education committee should be operationalized, should be functional. I'm seeing gaps. There is a person from Kololo, that boy from Kololo. The parent was the one who informed me. He looked for my number and he said she has been taken to Arua. She has abandoned her children there. She is now struggling with one child there. They are only giving food to the boy. For her, she is not catered. I said, I'm not aware. And indeed, I was not informed as a department. So there is a gap. We always come to know problems of health in education in such meetings. So I want us to have really collaboration, proper collaboration. When you go to schools and find as a health, when you go to schools and find something there, come back to education department to give information, which we can work together. That's why health workers have been facing problems with, health workers have been facing problems with the teachers. They say, now we are education, you are health. How can you come and direct me? So let us move hand in hand. Some teachers don't want to be supervised by health workers. And it is happening. A teacher is identified to be TB case. A teacher is saying, no, I'm not a TB case. I think it is happening in schools. So let us have one link so that we can do things. Where you have discovered something, if the teachers are resisting, we go together. We say, no, I'm your father. You must follow. If you don't follow, we discipline you. And as a health and the teachers become arrogant with you. You will not be disciplined, but you will report. But when you move together, we can take action immediately. So that's one gap I'm seeing. Another thing is the health teachers. We have health teachers. These health teachers should be regularly trained to identify somewhat diseases among the learners. This cough is there. The cough which is there. I don't know whether it is TB, it is a normal one. Children are coughing, but how to identify it to be a serious issue? Huh? The teachers, we have teachers, health teachers, they should be trained regularly. Now we have identified TB to be now a problem in the schools. We must not take it for granted. TB is in some few schools. TB is in the whole school, Maracha. You go at times midday there to schools. You find in the classrooms all the children are coughing. Even me, because I don't know how to identify it out, this is already a problem. Children are coughing, particularly when it is hot now in the classroom. Midday there. You go for inspection or mountain, children are all coughing. The room is hot. So my commitments are, one, screenings should be done timely, health teachers be trained, and health and education committee be functional to address these issues. P1 and the P4 in our schools. We have only less than 10 primary schools with less than 200 number of enrollment. But the rest of the children, the rest of the classes, schools are having over 200, over 300 learners in these infant classes. And it is a problem. We don't have large classrooms like this to accommodate schools like Kamaka. Kamaka is having over 500 P1. They are taught in one classroom. The one classroom measures 7 meters by 9 meters. They are taught, 500 learners are taught in one classroom. Now where can we take the excess? According to the police, one classroom is supposed to have 55 learners. But are we following it? Now if I go to schools and direct teachers, now you teach only 55 children in this classroom, and the excess put them outside there, abandon them. Will it look good? We have serious issues in our schools, inadequate classrooms. We always sing it, but nobody listens to it. So that's serious. And for me, I believe all those children are affected with their teachers. It is true. No space for teachers to move around in those classrooms, in infant classrooms. But the unfortunate part is, now these children, when they reach P5, 6, the number continues reducing up to P7, you see the population disappears completely. Like in 2018, we had 22,000 P1. But last year they reached P7, 2,338. Nobody is bothered to look for that difference, that gap. Where are they? But you say Dio. So we have our platform. We have informed all head teachers to organize PTA meetings with one officer from Dio's office who can go and sensitize parents on irritation of learners in schools. So we are doing it. No midday meals. These learners we have, our enrollment last year was 86,000 learners in the primary school. These children go without meals. They get their meals once. If they go to school at 7:30, 8, and then they come back in the evening at 5, at 6. So there is now possibility that these children take meals once a day. And there are few parents who can maybe give tea before the children go to school. But I believe it is not happening. in Maracha here. Children go be hungry the whole day. Now if they are attacked by TB, it weakens them faster, poor feeding, and so on. So I think I want to give this ratio. Teacher, we have 1,333 teachers. And when you look at the ratio, teacher-pupil ratio is 7:1. A teacher, general average, is now 7:1, one teacher. Now, we have classroom ratio. We have 504 classrooms. But this is it, 1 to 171. Then the latrine stances, 630. But it is 1 to 137. The latrine issue is very crucial. Children line up at the break time, waiting for one another. And the latrines, the smell, all of them enter and take the smell there. You can't come without. So we have that serious issue on the latrine use. The stances are very few. Now desk ratio. Desk ratio is worst. Children, many schools are still 1 to 9. Children sit 9 on one desk. 3-seater desk is supposed to be used by 3, but you find 9 children using one desk. It's happening. Not in phases, because they struggle. If you come early and you have sat there, you maintain it. You maintain it the whole day. So this is a challenge which are happening in our schools. It needs what? Concerted effort.
Okay.
All stakeholders to be involved. Thank you.
Okay. Now, the submission of the DEO is even open more wounds. It is opening more wounds. We have parents who are at home there, who are not bothered. We have parents who think there is UPE. But if you ask that parent to go and see the pit latrine where his son is entering bare feet, that pit latrine where your son is entering bare feet. But it's okay. Dio, everybody, where is he? He has gone out. He said for him, he cannot identify cough. Everybody can identify cough. All of us here. What you cannot identify is a TB. So we say, even when you're in church and you're hearing constant cough from one corner, identify and let us know that this person was constantly coughing. There is no cough which is normal. That's the DHO's one. So if you, and the cough of TB comes in the day, comes a bit very frequently. After a short time you're coughing. So even if that cough is only for TB, but if you hear me, even in this room here, hear me coughing, every 5 minutes or 10 there's a cough from me, please alarm the system. Is that okay? That was just to correct him, that for him he doesn't know how to identify cough. I will go to Nyadri, then I will come to him. Oh, no. After you, I will first go to Sana. Then I will come to you. Are you okay? You LC3 chairperson, so why
Good afternoon, ladies and gentlemen. I must thank the health team for what they have done, for the report they have given us, and also for improving the detection rate from 30% in 2016-17 to 111 in 2022-23. We thank you so much for that. But the unfortunate bit is the last financial year, 2023-24, it dropped to 65. Find the gaps. I know the gaps are what you had already listed. If all of us join hands to fight it, this detection will go higher than the 65 which is there. And also my other concern is the success rate. It was stagnating at 50, 40, and so on. It has gone to 94. Thank you so much for that. But the 6%, the 10%, the percentages which are there, they are with us in the community. Now my point is, for us to improve on the detection rate and success rate, the health units which are there should give for us, the lower local governments, reports of the people who are lost. If it comes from my sub-county, let them give that report to the sub-county so that we find out where this person is, because these people have the addresses in the registers. You give the addresses of the people to the lower local governments. That is, you give a report. If it means quarterly, you give for us quarterly report to the lower local governments so that we follow up the lost cases. We follow up those that have been detected are not linked on care. We follow up those others. We shall be together with the VHTs, the CHILs, and so on to work on that. If only we have report and whereabouts of these people. That is one. Two, we must improve on contact tracing, much as Dr. put it there in his recommendation. Contact tracing is key. Let us improve on that as health workers. When I was still an active health worker in Arua Municipal Council, there was one case from Pibia where we went to do contact tracing in a slum. We got 7 cases. So please, please, and please let us do contact tracing. Let us improve on it. Much as it is tedious, it needs facilitation and so on. Think about your personal commitment. If you are committed with or without funds, you can reach to those people. With the help of the local leaders, the VHTs, the CHUs, the LCs, we LCs, we can support to reach those people. 3, we have a beautiful education ordinance which is not being used. No level is using that education ordinance. It's my appeal that we should go and enforce the education ordinance so that we retain children in school. That is about the declining literacy situation in the district. It is us to improve it. If we do not enforce the education ordinance, then we shall miss out. Let it start from family level. Let it start from my family. How many graduates do I have in my family? How many PhDs, masters in my family? Diplomas and so on. Are your people, are your children at household level educated? Let it start with us leaders. We are now grown-up people. My last born is going to university this year. How about yours? Let us improve at household level and then community level so that we work together to improve the situation of TB. As was said earlier, if we don't fight it, the TB will come and look for us. Thank you.
We are now talking. Madam already said, people in the Maracha think that you go to school to come and get government job. Full stop. And when they see our graduates without a job, they say, what is the use of the school? And that's why the reasoning capacity is extremely low. I wish you knew Lugara very well. And I listened to some argument. I got up and said at the meeting, you know that is a very low quality. Sir?
Thank you. For giving me the opportunity. Let me get in front let all the protocols be observed. My name is Akum Pascal, the TB Regional Contact Tracing Officer, West Nile Region, working with SEHAD. The cases in Maracha regarding the case detection rate in TB, it's really an emergency. And of course, an emergency needs an emergency response. So as SEHAD has been supporting 13 districts in West Nile in TB contact tracing. And this year has been actually the first that SEHAD is facilitating casts, and is going to continue if we maintain this spirit of bringing out results during casts. Basing on contact tracing with what has come out in Maracha district, SEHAD has enough funds to actually start contact tracing all the cases which has come out in Maracha immediately, effective today, if the DTRSs are ready. If not, the subsequent week, like from next week, they can start contact tracing. We apologize in the break in responding to payment of contact tracing. It happened from last year, July, up to around January, and that happened because of some discrepancies which came in data. SEHAD came to realize that people on ground started engaging in forgery, where they found out cases that were being contact traced are actually cases which were not in existence. You find they would submit cases traced, and if you try to follow up these cases, you find actually these people never knew about TB. They have never been diagnosed with TB. And then you find some of the cases when they go and check in the ECBSs, they find actually people are contact tracing what? PCDs, of which SEHAD only facilitate PBC cases. So driving to the point, very many people lost their monies. You find they have contact traced 10 cases or 20 cases, but SEHAD would not hesitate to pay you for one person. Because people are not following the criteria which are supposed to be what? Followed during contact tracing. Now here comes Maracha. I would like to orient briefly the people who are going to be involved. I hope all the heads of the DTUs are in this meeting, because when data are submitted to me, I would not wish to see some of the mistakes, because if I see them, I'm subjected to bouncing them back, meaning they will not be paid. Now,
could we do this in a separate arrangement?
it's going to be very quick.
Because if they're here and once we break here, they don't go away, and you sit and do the technical orientation for them to understand what it means, so that we don't bother the other participants. You are here, they are here, but I will tell you the 14 DTUs, they are here. Stay behind for the 10 minutes and get oriented on what. Because this is very important. Sometimes we are the ones who spoil the soup for ourselves.
Yeah.
Somebody comes to support you, and you are there fighting things. Corruption is not verified. It's not about money in government offices.
So in conclusion, we are ready to support contact tracing for all the cases which have been detected, not only in Maracha district, but in all other districts which participated in CAS. And the facilitation is 20 transport per day and 17 DTU. So a case gets what? 37,000. Thank you.
Thank you very much. But throughout the discussions, did you tell these people what caste is?
Yes.
Okay, fine. Thank you very much. Otherwise, we'll be speaking now. I'll come here. The hands are increasing throughout. Let me make an announcement that in this meeting, amangaya nyafisi. It's a basic meeting.
Thank you very much. Protocol observed. I'm Waji Vasco, head teacher, Colorado Primary. knew if I could introduce myself early like that, some people will run away. Because I'm from that hot spot. Allow me to borrow the recommendations which were presented to us and to make them to be as one of the way forward. One of the recommendations was giving of TB prevention drugs. Members and the technical people who are on board helping Maracha district as concerns the TB issue. As being the head teacher of that school, within this shortest period of time, I've realized that there is some stigma which is moving on, and because of this stigma, some children or the pupils who realize that their colleagues have been tested and the result has turned positive, almost others are dodging classes. So, for me, I could say, if things could allow, if that TB prevention drug is there, if it could be given to the schools that realized to be the hot spots, such that the retention of these children in these schools could be done, I could say it will help. Two is testing of the pupils who have well shown up for the test, that is TB. I really want to thank Dr. Chris with the team. Yesterday when he convened a meeting and he talked to these children, as he has reported, majority of these children who were run away, they turned and said willingly that they want to know their status, to see whether they are positive or they are negative. And I could say, such children who have turned up positively to have that test, if the chances are there, if they could be tested immediately, it would also help such sport schools to retain these children in these schools. As I'm speaking right now, this morning we have a way forward which was given to us by Dr. Chris and the team, that every day we must be open and talk about this disease. And we have now passed it as a resolution that in all assemblies we are going to have in the morning hours, we must not miss to talk about this disease, which is called TB. So I think if these children could also be tested, I think it will bring them back on board. This morning, as I was talking about this disease in the assembly, I have realized that some of the children have remained at home. I think that might be fear or stigma. So the technical people are here. I think if that could be noted and taken into action, I will be happy.
Okay.
Lastly, okay, time is not our good friend. I want to stop here.
Yes. I thought you had finished. Because you have raised three issues. One is for us, DHO you will respond to, whether there is a prophylactic treatment for TB that his pupils must get. But the other two are commitment on what the school is already doing. If you have another one, please, because it's running.
As a way forward, I would say, it's not only the schools, as listed in their communication. We have the churches, we have other places. And one of the best places where we could deliver this information is the church, where majority of our community members are there. So I could say, if we could bring, have not realized the presence of these religious leaders, if we could bring them on the board in all church services, if this could be aired out in a minute or two, I think we could curb down this disease. Thank you very much.
Thank you for those submissions. Alini, was your hand up?
Yes.
Yes, there's so many names. After this, I'm going to ask a question and say, what do we do?
Thank you, Chair, for the opportunity. Aware that we're in an emergency situation, and this disease, TB, is a disease of national importance. I wanted to say that we're in a very difficult situation as a district. At the district level, we are already engaged. We have other leaders who are not yet here. I thought this information also needed to be escalated to the highest level, to the August House, to be raised as an issue of national importance. So that as we are speaking here at our local level, somebody should also be speaking at the highest level for us to attract resources to meet this. I want to speak also on the other side of my facility. I work in the Kijomoro Health Facility. In the cast we participated in, we collected about 90 samples, and so far we have not detected any positive case. I want to make a commitment on behalf of the facility that we will go down and look for hotspots. We realize we might have not reached the hotspots to pick those samples, and yet we have a very big catchment that we could be able to get these cases. So on the side of Kijomoro, we had the engagements at facility level with our VHTs and CHUs who want to reach the unreached and be able to get those cases. And I want to commit that we'll be able to also have cases detected from Kijomoro side. Over to you.
Thank you. This second commitment applies to all health facilities. And your first issue has been picked by the analyst who is the chair. You have opportunity of communicating to members of parliament. You are aware that that announcement will come from you. You are aware the Minister of Health is visiting this district. And we have invited the MPs as well. So these are issues that you can discuss at their level and say, what can you consider this as a matter of national importance? And you rise on the floor of the parliament to say this is the situation in the matter. Now, don't you think we should be ending? Because, you know, these chairs, most of them are yellow, and if there's nobody on that chair, you will know that it is an empty chair. Because people are stepping one by one. What should we do? I want to think that there are issues that were raised that need responses from the district health officer or his department, then Ministry of Health or WHO, and then we head towards closure. But the truth is that we understand the magnitude of this problem. As a health department, we have already started engaging our colleagues. The document that WHO was talking about, the response plan, is about 80% done, and we're using this opportunity for this meeting to feed into that plan, and we'll complete it. I want to say that maybe by Monday next week, which though is a very busy day because they changed the program. The minister who was supposed to be in Koboko on Wednesday is now going to be in Koboko on Monday. Yes, so it might keep some people also a bit busy. But by Monday, we really want to have this document finalized and discussed and shared with other stakeholders to review so that we have a final document. And it brings in, sorry? Tuesday. The minister will be here on Tuesday. And we sent out invitation letters. We had only invited the mayors, not mayors, the deans. But Madam Aradis, I think it's very important that all of them come. Because there's no, we see that there's no money value, no what. So all the sub-county chiefs all the LCC chairpersons. You are invited for this occasion when the Minister of Health is coming here to pass out the community health extension workers. All of you have people in that team, and the proposed venue is primary school, 9 to 1:30. Responses? DHO, you can start on issues that were meant for you.
Thank you very much. This meeting has been a success in my opinion, and I will respond only to very few issues. One was on the formation of the composition of the sub-county or lower local government task force. The task forces are usually flexible, but there are certain members that are constant. For example, in this case, you need the DEC, the SEC, they call it the SEC, Sub-County Executive Committee. You need members of the Sub-County Technical Planning Committee. That, of course, among others, includes the health facility in charge and the health assistant, or those in that area. If you are blessed like the Yivu Sub-County that has more health facilities than one. It has the parish chiefs. Now that we have technical officers, though not with the certificates at that level, the community health extension workers, we bring them on board. It has the religious leaders and teachers of schools, or representatives of those schools, because the issue in question can be addressed among other things, others better by schools and then people in the places of worship, or religious leaders, and of course cultural leaders, because of the connotation that this is a caste, whatever. They are the very people who can help us in this. But the list can be longer. However, these are the key stakeholders in that task force. If you have partners that are implementing in your specific sub-county, please bring them on board. You remember in the context of PDM, there is also PDC. I don't know how many members they are. I need to be oriented in that area. I hope I've responded to that one and it has helped everyone. On the issue of stigma and so on there, I'm sure the health facility in charges are here. Team up with your sub-county counterparts, the CDOs at that level, and anyone plus the teachers, and ensure that you work together to fill the gap in stigma. And the best way of addressing stigma is by providing the rightful information, including this one that we told you, that TB is an infection, it is curable, and the medicines are free and available, plus others that they want to hear. If you provide that one, you will leave no room for doubt. The issues of whether there will be money, when are we starting, we have started. That's what I can tell you. There is no additional money. As we mobilize for resources, we have PHC funds, they are available with us. In times of trouble, we sacrifice. That's why we thank you people for sitting here endlessly, even without a drop of water in your mouth. It is time for trouble and response. So please, facilities, let's know where our hotspots are. Let's get outside there and start. The rest will flow. If it flows, it will follow us. But our leaders don't wait for the health department. They shout here, amplified. Our voices will go higher and louder. Lastly, if I have not responded to other issues, I want to tell you people that as a health department, we are very committed to
ensuring a healthy population in Maracha in accordance with the vision and helped by our standards of primary health care, you can only best deliver it through intersectoral collaboration and a multi-sectoral approach. That's why we are very grateful for your presence here. If I say certain things that touched you personally or as a group or as a party and so on, I know this is a politically charged period. For me, I am this committed civil servant and a committed citizen of Uganda who wants a better Uganda. If anything, our motto would be in St. Joseph's College of Bati was first among heroes. So we have set the kind of pace as Maracha district for the rest of the country. I'm sure if WHO and the Ministry of Health and partners learn from the best practices we are going to have here, expect more resources to flow in, including even adjustment of budgets to provide for more space for our schools. I think I want to end there.
Thank you very much. Yes, don't be worried. Gara is different from big Guru. Because on the Tifagara you have nothing to do. If someone tells you big Gurunya, that means you actually did not comb your hair. You what? Go and comb your hair or shave it. So your comments were around the big Gurunya, I'm not into that. Because God is there. But there's one point you did not respond to, which I wanted to respond to, raised by Chairman Alikwa. 14, the DTUs. You were there, but what in using his airtime?
Yeah, let me use this airtime. Good afternoon, everybody. I'm called Bada Edward. I'm assigned as a district TB level supervisor. I've just come to respond to a few things. One, there was a question raised by WHO, Dr. Chris, why long turnaround time for these samples we have just produced. The basic reason was we did district orientation on 7th of March, which was very early at the beginning of the March. And then on 11th, they did the sub-county or facility level training, and they started implementation in the afternoon of 11th. And then on Friday, that was 15th, we concluded cast in Maracha. With the exception of one facility, Ivoabia, that started a day later. By the time we started our cast, we had a balanced stock of cartridges, which were 2 boxes here, 2 boxes the other side. And they started running our samples, and the first batch produced for us around 13 positives, which were not from WADA and Tara. And we reported those ones earlier. As soon as they finished that, within 1 week, there was shortage of cartridges in the region. We had to wait until when they came. When they came, they also resumed immediately, and that's why Tara also came. It was now in April. We could not report all these cases for March that quarter. I think I've answered you. The second was raised by Alikwa, the chairman Alikwa Sub-County. Status of Ivoire Beer Health Center was not clear when my teacher was presenting. That was basically not true. Ivoire Beer participated fully. When we started our district level orientation, we invited our IPs who support us. Like IDEA supported 6 facilities. SEHAD picked for us 3 facilities. We're in this same room. UCMB, Flash, picked St. Joseph's Hospital, and the UPMB picked Ivoabia. And all these partners helped these facilities, and they produced the results. Samples were picked, like Ivoabia gave us 80 samples. But the difference is that they started theirs 1 day later and they finished on Saturday.
but their samples were all received, except that we did not get any positive from their results, from their samples. The chairman alikuwa hivyo pia worked so hard and gave us samples. Why 14 facilities were only selected when this was presented? These 14 facilities, we call them diagnostic and treatment units. These are facilities that have laboratory personnel with a microscope to examine patients, the TB germ from there. And they have health workers who are to manage the cases there. They are called DTUs, they are 14. And in the system, when we are entering this report, we use DHS2. These 14 facilities are there. But the remaining 6 or 8 facilities that you did not see here, like Loinya, Odupiri, and so on and so on, they are called treatment units. We just give them the medicines. They have some cases there in their catchment. We give them the medicines, they treat them locally there. But without a microscope or a laboratory personnel being assigned to work there. That's why you don't see them here. But they worked. They were working under another facility, like Loinya, Amanipi. They were working under Wadra Health Center because they were supervised by Wadra. And then like Udupiri worked under Tara Health Center. Liko worked under Oleva Health Center. That is how the arrangement is. Thank you so much.
Thank you very much, Edward. But we take advantage of this opportunity of this meeting to advocate. The region is here, ministry is here, that the 3 upcoming facilities must be accredited as DTUs. If it is lack of microscopes, let us have them. Because there are two more health center 3s that are functional, that Edward, they are not DTUs. But Caligo is a fully fledged health center 3 which is coming up, and the Ambito has been in the dark for a very long time. So start speaking to them for 3 microscopes and we take them as DTUs straight away. There was an issue of the stubborn TB case. What do we do, Alex? Dr. Alex?
I want to start from the headmaster of Kololo Primary School is concerned. People, children, some of the children are already remaining at home. It seems there is a fear or stigma. So I have idea here, I have Sehad, we are already drawing plans. We are going to start immediately together with the Tara team. We are going to do more screening, we are going to do more counseling. And the catchment area of Tara, the ones that we listed here, we are going to share with them, but we have a plan and that will feed into the task force. Whatever we are doing, we are feeding the task force. But for those who are positive, we are going to, he's going to sit with the DTLS and they plan what to do immediately so that we bring those children back to school. And even the stigma, we have not tested the teachers. We don't know the outcome. We are going to test the teachers, non-teaching staffs, and the family, everyone. But the team are going there immediately. Yeah, but going forward to all the in charges, you heard what we are saying, our hotspots, all of them, I think we are sharing the list with you. The in charges are going to work with you people, the sub-county chiefs. Please help them align list. It is not Tara issue alone, it is Maracha issue. We want to go to all the hotspots. Now, coming to the person who doesn't want to finish treatment. It is only in Sudan where things are difficult. Because I was in Nimule some time back, they told me when you are in Sudan or you are in Nimule, you don't tell somebody, go and take treatment, go and take. Huh? Because every home has 2 sticks. So if you go and you talk anyhow, in the evening you may be caned with one of the sticks. So that is only impossible in Sudan. But here we have a law. We have public health law. Public health law, and we also have bylaws by sub-county chiefs and LC3 chairmen. We have bylaws. The first question I ask is, if I don't want to dig a pit latrine, I want people on the roads, people step on it and so on, so that I get money. Some people have those kind of beliefs. What do you do? What is the bylaw against that? I don't want to dig a pit latrine. I want to infect people. What is the bylaw? The LC3 chairman who are around. What is the bylaw? Huh? I don't want to dig pit latrine. I thought there is a moment where you check people who have pit latrine and so on. Huh? So if I don't have in my home, what do? Yes, you are arrested. Eh? You are arrested. So in the same way, if I'm a case, I don't want to take treatment, we have Public Health Act law. You must not infect people by force. I can give you an example. I had MDR patients. I've been known for arresting MDR patients. I arrest them, I take them to MDR treatment unit, Arua. I don't take them to prison. I take them to Arua, we treat them, and we send them home, and they say thank you. After treatment, they always come and say thank you. But I've been known for arresting them. I even go up to a Juman to go and arrest them. And we put a pingo. You put a handcuff on them. The first MDR person was around Oluko area. He told the community, the people in Arua, together with the MSF, they killed 52, and he is the only survivor. And the community was quiet, but they were all behind him. So, when we realized, we didn't know, so we went looking for him. We cancelled over 20 times. So when we went looking for him, he took off. We started following him, the community was running after us. The community wants to arrest us. So when we saw the number was growing, we stopped. Then we started educating the community. When we explained the situation, community became annoyed and started running after him. And they got him. We treated him, as I speak, he is part of us. When we go for health education, he is the one to speak. Because he used to wait for health workers with the bow and arrow, with the catapult, with the spear. So to treat him was very difficult. We asked up to ministry, what do we do with this person? We had no solution. Until when the team in West Nile, from RDC, LC5, plus all sat down and made a bylaw, go and arrest. So we went to arrest, and every one of us was given a responsibility. For me, I was given a responsibility of giving N95. Secretary for Health, Arua, was given a responsibility to go and look for handcuff. And the prison commander was supposed to supply. There is no, you see, no. The DPC was supposed to give a vehicle with the 5 police officers, and the commander had 3 stars. And then there was a person to go and check the legal implications. So we went to operations. We went and arrested him. When we reached, we got him on the compound, and he asked, now, Alex, you have come with all this police, you should have come alone. Now, how do I come alone when you have beer and spear, you have bow and arrow, how do I? But in summary, some of these persons' behavior changes because of the medicine they are taking. Especially the other type called MDR. Some of the drugs can make their behavior to change. Some of them can actually rape. They can rape women. Some of them, we cannot allow them to be attended by a female nurse alone. There must be a male nurse. So it changes their behavior. So for this one, for us, we have not failed to manage a person. That one, we can have a bylaw. If he refuses, we shall arrest him and put him on treatment. And I know he will thank us. So that one must be arrested, but we don't take to prison. We take, if it's very difficult, arrest, take to us in Arua, we shall treat. Is that clear? Thank you so much.
Ladies and gentlemen, I'm a bit impatient with our time. Madam RDC, This is another one on your table for us to manage. The nitty-gritties we can discuss outside that. We shall get back to you for detailed information about this particular patient, and then we will handle with support from Alex and DHO. Is there anything from Ministry of Health and WHO? Yes.
Thank you very much. Yeah, there are just a few issues that have come out in our conversation that I'd like to put into context. One was the recommendation by Chair that our response plan, since this is a disaster, should go to OPL. Yeah, well, this is a public health emergency of international concern. We have 7 classifications. Those that are in the health sector go to Ministry of Health direct. There's only one component that CAO can liaise with the PS of OPL to have addressed, and that is the one which involves food, in case we need food for these people. But the rest, medicines and so on, the competent team to handle it and to support is the Ministry of Health. Then the second one is, I had somebody whispering, what do we do with the children that have tested positive? We send them home. So we don't need to send these children home. Medication don't take long. What we need to do is to improve IPC measures, infection prevention and control. One of them is ensure they are wearing their masks. 2, you can create a safe corner for them, separate from the rest, so that they're not sharing these desks of 1 desk to 9 people. You can maybe create 1 desk for them and have them sit in front where you can monitor, and they're putting on their what? Masks. Otherwise they will lose a full year. Then the issue of traditional healers, we talked about them. Well, these people are registered, these people are licensed, meaning they are businessmen. So what we need to do, just like the private sectors, is to work with them as influencers. You and me don't listen to them, but there are people that believe in them so much. So what we do is give them a message, convert them, and then they will give the people the message we want. They will report alerts to us, and we'll be able to pick these people. Okay, that is what we have done with Ebola, we have done that with COVID, we have done with so many things. And they will surely come on board if we do that. And then the other one is the issue of the arrest for difficult cases. Well, I am a medical anthropologist, and I have so many people that are always difficult, whether it's Ebola or what. That's my responsibility to make sure we bring the hesitancy down and make them compliant. As the last component is basically engage with these people. If we engage with them, give them useful information, answer their questions, there's no need to handcuff. If, for example, you arrest and Alex is not there to support them in Arua, some policeman is going to put them in the cell where there are other people. And from the cell, we will go to an institution where people don't know how to manage. You will actually cause a lot of panic there. So the most important thing is equipping these people with information. They will, I'm telling you, behave. If you have difficulties, please send a message to the minister. We'll send a specialist, including myself. Just map your cases, we'll come here, and you will have no trouble with that. Yes, I think there's something about our schools. There is a lot of sharing of utensils. I'll talk about Kololo that I know well. 1,500 pupils. They are using 10 cups to drink water. So per cup, 150 children. That is the cup ratio, cup pupil ratio. So the recommendation for all schools, please, let's ensure that each child comes with a water bottle or a cup, so that we limit sharing. That's one of the IPC measures that we would recommend. Just for emphasis again,
We are living here, but I see, Chair, please, let's have the pillars functionalized and let each pillar look at their component in the response plan and make sure that what they want is in the response plan. Thank you very much.
Thank you very much, Dr. Cho, and that's correct. But before I hand over to move to the item of closures, amidst us is a traditional BHT and a TB advocate. Mashu, wait for people. Edward is one of those who are trained. I attended the burial. He didn't know I was there. After the sermon, as people were preparing for food, and he went and said, "Can I say something?" The catechist gave him permission, and what did he talk? He talked about TB. In my presence, but he didn't know whether I was there or not. Let us simulate him. We have been in meetings here before. The religious leaders have thrown it back to us, and they say, even during their sermons and congregations, there is no health worker who rises up and says, "Can I say something?" We're here. I don't know whether you were present. They said, okay, two things. That many of us don't go to churches. And when we're there, we don't seek to speak to the congregation. We don't ask permission. So the ball is back on us. Can I invite the Honorable Secretary, Works and Technical Services, to represent the chair, this chairman, to close, and you later ask the chair of this to officially close this meeting.
Yeah, thank you, moderator. Well, the Secretary DC, who is the chair of today's city, people from the Ministry of Health, my brother, Dr. Alex from the region, the DHO, the COW, all invited guests. For purpose of timekeeping, I observe the protocol. I'm Wagachas. I'm here to represent the LC5 chairman who has gone for another commitment. I'm very grateful for the organizers of this meeting, because they have taken concern which I raised the other time, last month when we had a meeting in the Tropical Inn. It was me who mentioned that there are rampant cases of TB now in our schools. And I only thought of those schools bordering Congo. I can vividly recall I mentioned Bulukua, I mentioned Kamadi, I mentioned Galia, and other schools. And today, in the presentation, I'm able to see the schools which I named that time. Doe Lema. Their members, therefore, let us agree that TB is now real in Maracha. It is now an outbreak. It is an outbreak now, which needs our efforts to fight it. I'm very grateful that we have people from ministry, we have people from the region, and we at the district level. Truly, it needs intervention from outside. As a person, I would recommend that we have massive screening campaign for TB. We should target everybody now in Maracha. I don't know if that one is going to be possible, Dr. Alex. Massive TB screening for the entire population of Maracha. Like any other campaign we have ever done here. So that we really see the magnitude of the TB attack. Which means all the schools now in Maracha, we have around, the government aided are around 63. DA was gone away. Both primary and secondary. But if we take it to some of these secondary schools,
which have dormitories. There is no doubt that TB is now with us. You go to Oliver Seat here, you see how students are sleeping. That congestion is just beyond control. Go to Maracha SS, go to Kijomo. Actually, all the secondary schools in Maracha which have boarding system. The congestion there is terrible. Then I suspect there must be TB. So can you also go to these secondary schools? If you are able to get from Maracha High, which has fewer students, what about these other giant schools? There must be TB there. So, Mr. Bada, I ask you, go to these schools. And those who are going to be tested, they must be taken. They must be linked to treatment immediately, or they must be subjected to treatment, not to lose any contact. Then once you are tested positive, you must be linked direct for treatment, and follow-up must be made. We have the VHTs on the ground. Let us use the VHTs. Good enough, we have the tubes. Let us make use of the tubes to make contact tracing very, very easy. I remember on 29th June 2022, when I was still secretary for social services, there was orientation here for VSTs on TB. And there was a question that time whether all VSTs are engaged in TB tracing. That question came. I don't know if the pattern has changed. If all VSTs now are engaged in mapping TB in their villages. DHO, what is the answer? Yes, I talk now. So can we engage all the VSTs now in mapping TB cases in their villages? We have a good number.
They are all doing ICC, under ICC.
Yes. Yeah, I think that is a very good positive change now. From 2022, this is now 2025. If they are now all engaged, I'm very happy, which means we should be having regular testing of TB. About the congestion in the schools. This year, I don't know what we are going to do as a government. Congestion is really real in the schools, particularly in the infant classes. Members, if I can tell you, as I talk now, we have got IPA for next financial year for classroom construction or for rehabilitation. Like this ending financial year, we got 1 billion. And we're able to renovate 9 classrooms only. Now come next financial year, it has been reduced to 500 million. We cannot construct a new class, neither can we rehabilitate more classrooms to accommodate to decongest the population in the lower classes. What can we do? As if it is not enough, we still have even more pupils at the home who are not attending classes. But those who are already in the class, who are already enrolled, we cannot even take care of their accommodation in the classrooms. It is terrible. And as they explain, TB, when the population is big, that's when TB goes very fast. Because it is got from the air. One time you go to these schools, you go and visit these infant classes, you will hardly breathe. The air there is very hot. I don't know how the teachers have survived there. As you enter through the window in the classroom, the air there is really very hot. What cannot happen? So, as a government, I think we are getting defeated as far as the congestion in the classrooms is concerned. It is not a response which can be got very easy. Maybe we could decongest this infant classes by renting tents, but where is the money also? And that will also need intervention from implementing partners. Because a tent alone is around 2.5 million, which the schools will say they don't have, and truly they don't have. Because UPE cannot do that. But we need to decongest what? The lower classes. How to go about it is food for thought. Minus that, TB will continue to be living with us. I don't want to waste your time. Next Sunday, you will say it. Sugar levels are not down. So, can I take the responsibility now to welcome the RDC to close? Or you have other things to communicate first? So, with these few words, I will come you to close.
Thank you.
Also take a short time Mr. I have taken.
I think now you know that. But I normally take a shorter time. I want to just communicate the following. That DHO and team, we will still have to communicate to the entire population, and as usual, you organize and we shall be able to have radio talk shows under our office. That is one. Two, this month is for Child Health Day Plus. I think the issue of vaccination should still continue to be enhanced. We need more mobilization in that area so that we can be able to lower the issue of TB. Another key area is in the areas of concentration points. I wanted to add the issue disco halls. Disco halls as one of the concentration points, and especially that one which is called, is it La Liga, which is in the village, in the dust, and almost at household level. That one is very, very key. We want also you to map up that so that those are included in the hotspots. We are aware that next week the minister will be here with us. And one of the things, I was in the field the last 2 days, and I was able to visit our training institutions for nursing and midwifery. I thought I should be able to raise this here. They are raising concerns that we need to educate the population on the new entry requirements for nursing and midwifery. It is causing some hiccup on the ground. It is causing hiccup, and parents are not understanding what is happening, that now their children cannot go for nursing because the requirements are so high. I think we need education, we need information to the parents about that. As I said in the beginning, that tomorrow the president will be with us, and I invite all of us to be participants in that visit. We shall all be in Yumbe. You are all most welcome. Lastly, I think there is also where we are supposed to sit, DHO and the team. We should be able to come up with community health bylaw. The only bylaw I've seen here is for education, but we need a bylaw in community health. What is the standard size of a sleeping house? I think we need that. Standard, no, let it be in our community thing. the standard size, the standard window, the standard height, and what is the standard also area for a toilet, a latrine, and then the height, and what is it for a bathroom? The people bathe halfway out. What is it? I think we need to talk with the engineering department, and they should design a simple thing, so that as we talk out there to mobilize the population, we can use that as a talking document for housing and for latrine, and for might be chicken houses, for goats houses, and those kind of things, so that they will be able to, we can have a beginning. They have they can use their own labor to do some of these things. Some of this does not need even a lot of money. But if we inform them of the beauty of having all this, many of them will be able to take it up. The good thing, where I have moved in communities, when they say, when they hear the RDC is coming, the LC3 is coming, for sure you will find the population is gathered. And if we communicate from a real point, from an organized point of view, we will be able to slowly by slowly cause a change in the minds of our population. I want to say thank you to our partners that we have already taken off with the field activity, and I wish all of you the best. We shall also be there, and we shall still share the results when the activity is done. Thank you so much. Have journey masses. And with all this, I say our meeting of today is officially closed. Thank you.
Thank you very much, Madam RDC. The take-home message here is that let us all go and wash the thick mud at the soles of our shoes. There's a thick mud at the soles of all our shoes. Go back and wash them. If it remains fast, putting it in water for it to soak, do, and then later clean and put all the shoes. The chair has dismissed us. We may cheer now. I missed one thing. Derek, group photo out there.
Outside here. It's evidence. Thank you so much. Let's go for group photograph. Hey, you people come.
No. Group
photograph.
Chairman.
Region. IPs. Deans.
Please be with the
behind.
Are you all visible?
Yeah. Yes. You worry about the sun heat is too much. Yeah.
I am Angiopol reporting. Woo, the heat is strong.
I've been driven to the Ismail, so don't ask for